thank you so much for joining us today. This is our first ever webinar, so a little bit nervous and excited. I'm Sam. I'm the AFPP Regional Nurse Coordinator for the Pilbara Aboriginal Health Alliance, or PAHA, and I'm joined with Scott. And if you'd like to introduce yourself, Scott.
Yeah, g'day everyone. My name's Scott McKenzie, Albany boy, working in the Pilbara as the Environment Health Project Development Officer currently. I have been working in Aboriginal environmental health since 2012.
Thank you, Scott. So look, we really appreciate everyone joining today. We are going to be talking about environmental health referrals for mums and bubs with a bit of a Pilbara case study and pilot program. We'll run through the presentation and then we've got lots of time at the end if anyone has any questions or feedback. More than happy to discuss and share that then. I just wanted to start with acknowledging the lands from which we're all dialing in from today, and we acknowledge and pay respects to the traditional owners and elders of this country and recognise the significant importance of their cultural heritage, values and beliefs, and how these contribute to the positive health and well-being of the whole community. So I thought I would just start a little bit about AFPP, or the Australian Family Partnership Program, just to set the scene. I'm not sure, I can't actually see who's in attendance, so if I've got any of my AFPP crew in the house, if so, please shout out. So AFPP is a child maternal health program that's been run across the Aboriginal medical services in the Pilbara. It's an intensive home visiting program designed to support mums to parent their bubs and their families from pregnancy up until the child is 2 years of age. It consists of regular home visits that are completed in pregnancy, infancy and toddlerhood by a home visiting team, which is made up by a nurse home visitor and a family partnership worker. And the program has the aims to improve pregnancy outcomes, support parents to improve child health and development, and support parents to develop a vision for their own future. And within the program, we support the family in six domains, I should say. My health, my life, my child and me, my family and friends, and my home. And part of this work involves building trust with families and ensuring culturally safe engagement, which is critical for the program's success. The holistic approach of AFPP ensures that maternal health is not just about medical care, but also about the broader social determinants of health. And that's our lovely Pilbara team that are working across all three, the Headland area, the Roban-Karratha area, and the Newman East Pilbara area. And what I wanted to tie in today with it all is the recent NACCHO and Royal College of General Practitioner National Guide to Preventative Healthcare for Aboriginal and Torres Strait Islander people, which reminds us that prevention begins a long time before a person shows signs of illness. It starts in the home and the community environment. So that guide, the National Prevention Guide, has actually given expanded environmental recommendations to support referrals to environmental support services when available, and advocacy in topics where environmental and living conditions strongly contribute to morbidity. This includes child and adult kidney disease, ear health and hearing, acute rheumatic fever and rheumatic heart disease, trachoma, asthma, and respiratory illnesses, to name a few. And in addition to that, and you'll see that lovely circle next to it, is the ACWA, the Aboriginal Health Council of WA's Environmental Health Model of Care, which is grounded in the same understanding. It recognises environmental health as a core part of clinical practice, not something separate. That's safe housing, clean water, working health hardware, and effective animal management as all essential to preventing disease and supporting strong, healthy families, especially children. So for clinicians, this means when a child presents with something such as an ear infection or skin sores, it's important to also consider what might be happening in the home environment. Could there be concerns with the house, with pests, with the health hardware, which is like your plumbing fixtures? We want to see environmental health as central to holistic culture of safe care. So when we connect what we see in the clinic with what's happening in the homes and communities, we can support families to address the root cause of preventable illnesses. And so even if there isn't a local environmental health team, clinicians can start the conversation and help families link in with local housing, local government and public health services for practical support. And we'll go through that in a little bit more detail. All right, I'm going to hand over to Scotty, who's going to talk about Aboriginal environmental health and what it looks like in the Pilbara.
Thanks, Sam. As we can all see by the map, circled the area of the Pilbara, which is quite large. These are our 7 wonderful FTEs that we have as environmental health practitioners within that region. I'll just quickly note that an Aboriginal environmental health practitioner is not it's not an environmental health officer. So the practitioners have a more primordial and primary prevention aspect to their work, where the EHO sits more regulatory under the local government, state health government. So they're quite separate. We have a more focused on community health prevention, basically, these guys. So there's 7 of them in the Pilbara. It's a large region, and they're quite spread out. And they're working in the major towns like Karratha, Port Hedland, Newman, as well as the remote communities and reserves around those as well. So that's their role. Within there, they work within the model of care, which Sam just briefly touched on. She also mentioned 6 domains for her AFPP program. Within the model of care, there's 6 environmental health domains as well. And I'll just apply the 4 here, which is healthy homes, environmental health referrals, animal and pest management, and advocacy, coordination and partnerships. And they're the sort of 4 that we're focused on throughout our talk today. But basically, they can do healthy home assessments, minor plumbing fixes. They can do animal and pest management. And we look at that because if dogs have, say, community dogs have worms and mange, that can be passed on to human health as well. So we're treating the dogs for human health. We're not treating the animals for the animal health, so to speak. It's just a bonus part of that. So that's their role throughout the Pilbara. And quickly as well, as Sam did mention, you may not have these Aboriginal environmental health practitioners within your area, particularly the Southwest, Great Southern and Wheatbelt region. Derby Yerrigan in Perth Metro do have a very small service, but Goldfields, the Gascoyne, Murchison, Central Desert, Pilbara and Kimberley all have this service to your areas.
Thanks, Scotty. And I'll let you go on to the next slide.
Yep. So a little bit of a background into how we came to this. Through environmental health referrals, we're finding things like Otitis Media, asthma, with issues that were being referred. But by the time our environmental health team would go and conduct an investigation on those homes, there's very little that we could do in that space to improve the living outcomes that was going to, help with the prevention. So if we're looking at things like scabies and trachoma, for instance, those are things around the ability to wash, overcrowding, those sorts of situations. We can chip in and help out. We can fix the plumbing. We can spray for pests. We can make sure there's a functional washing machine. Those sorts of aspects of that investigation, we can improve the living environment. But when it came to things like Otitis Media, they were a little bit stumped, or the program itself was a little bit stumped. So we thought, to get in front of it, we've got the ability to thrive. Can we get in front of that stage? And can we actually make the environment a safe, livable, healthy space for mum and bub coming into the world, rather than waiting for that disease to be diagnosed, as Sam mentioned earlier on.
Thanks, Scott. We'll probably make a note. We are assuming people understand what these clinical environmental health referrals are. We don't have the time or the platform in this presentation to go into those, but more than happy to be contacted outside of this presentation if it's something you're keen for more information on, and we can connect you with your local environmental service provider. Okay, so as Scott was saying, you know, in the environmental health teams they were establishing that there was a part of the referrals that they were actioning that they couldn't do a lot for once that illness was established and sometimes reoccurring. We also found through the Australian Family Partnership Program that the team recognised there were some parts of the wraparound care that they were trying to provide in their service that also where there was a big gap, you know, and they were aware that the existing clinical referrals were only once illness was present rather than before it began in that prevention space. And acknowledging that investing in the first 1,000 days of a child's life can change their life course. So in the Pilbara, the 3 Aboriginal medical services, alongside the 3 Aboriginal environmental health service teams, developed a pilot program called the Maternal Environmental Health Referral, which would be offered as part of maternal routine care. These opportunities were going to be offered to the lady at pregnancy diagnosis, pre-delivery around that 36 weeks, and then around the 6-month mark when bubs crawling around. So the AFPP team took ownership of submitting the maternal EH referrals, and then they would agree to partner with their local EH team to complete a healthy home assessment during one of their program home visits. This was to ensure mums had access to functioning health hardware. Any small or minor repairs that needed to be done could be done on the spot. If there was things that needed further work or referral, the EH teams could refer also to the relevant housing authority. So by doing so, we're trying to change the focus from disease to health. We're actually using pregnancy as the diagnosis in this instance, not disease. And by doing so, we're trying to break or stop that trajectory of developing Otitis Media, ARF, RHD, trachoma by creating healthy homes from the beginning. And this is an example. So if you haven't seen a clinical referral before, this is an example of the generic one through the Environmental Health Directorate. And then highlighted there, you can see that in the Pilbara, we've actually included a maternal AFPP tick box. And by doing so, that lets the receiving EH team know what to expect. And maybe, Scott, you'd like just to give a bit of an overview over how that's a bit of a change of practice that the EH team's receiving.
Sure. So just a quick overview of how this system works. Somebody currently would, and this is just excluding the maternal part for a second, somebody would present at the clinic, the doctor, which is an environmental health illness, and the doctor would complete a referral form, forward that on to the local environmental health team to conduct an investigation within the home. That team would then conduct the investigation, carry out some changes within that environment, and may refer on to other support agencies and to like housing, tenancy support, those sorts of things, do some fixes. They could possibly spray for pests, and then they would report that back to the doctor on their findings of what they've done, so they can sort of complete that duty of care with the clinician.
Beautiful. Thanks, Cody. What we then found through the work that we were developing, because we really were developing this as we were going, was that the clinical team or the AFPP team weren't really familiar of what was involved in a healthy home assessment, and also weren't sure how to bring it up in a non-judgmental, non-shameful way. So what we did is together we co-designed a what to expect during a healthy home visit as a guide for the visiting clinical team to bring up the offer of a maternal health assessment with the mum and with the family. And by doing so, we're not assuming that the mother does or doesn't require support in her home. Instead, we focus on offering and letting the mum provide an informed choice. So this fact sheet walks everyone through it and serves as a conversation tool. So we found sometimes if we just ask, would you like a healthy home assessment? Mum might say, no, everything's fine. But through it, if we actually go, is your washing machine working, or have you had an issue with pests or cockroaches? It does open up the conversation, and then mum might say, oh, actually, yeah, I am having an issue with that. So from that, if the mum says yes, that would be something I'd like to have, they will work. The AFPP team will work with the Pilbara EH team to do a combined home visit. Whereas you can see here, the AFPP team are yarning with mum and her family, and at the same time, the EH team are going around the house and checking the health hardware, plumbing, the washing machine, and those kinds of things, which I will let Scott talk to you about, because again, this is all new for all of us. So it was a real developing fun time.
Thanks, Sam. So as Sam mentioned, she just gave you a bit of an overview of what the key sort of factors that we're looking at the home, because we are looking at them as from an environmental health point of view, quite differently to say, there's a presentation of disease. Some of the factors are the same, like the ability to wash, for instance, but also, we've got to take into account the bub and what the bub's environment may look like. Straight away, is there a safe sort of sleeping space? Is there a functional tub to wash bub in? Yards for when bub becomes a toddler and starts moving around. Are those environments safe? Is the floor in a safe condition for bub to be put down on? So we're actually looking at it a little bit differently regarding air vents within houses, trying to stop that asthma, all these preventing, is the whole environment a lot safer for bub to come into it. So we conducted a training session. It was a real life pregnant mum. So this is a real session that we did training, and I do appreciate her time and allowing us to do this within her home. So we walked through the whole process, room by room, had discussions around what we were specifically looking for, where we would look, things that we could, maybe assist the family with improving, like any chemicals that are low, can we do some education around bringing them higher off the ground or within cupboards, those sorts of things. The yards, pests, anything we could do to sort of help and improve that environment and get it ready for mum and bub in the near future, and then obviously provide that support after bub's been born as well. But we also wanted it to be really clear around what that referral looked like. So when we're in the home, we wanted it to be really consistent. So we wanted to work with all the environmental health practitioners to make sure that the service that mum was getting was the correct service that's going to benefit them in the long run. So we trained on that. We trained what that program and what that investigation and what those outputs would look like.
That's really true, Scott. And from both sides, so the AFPP clinical team, we made sure that we were all on the same page on what we were saying and presenting and offering. And then, like Scott said, the EH teams are making sure so that the service or a maternal referral response, no matter where you are in the Pilbara, is the same. So it's a consistent, standardised response. And I'll just my slide. There we go. And that's kind of highlighting what Scott was talking about there. If there's anything you wanted to add.
Yep. So these are some of the things I just said. Some of the treatments we're looking at: clotheslines, hygiene kits as far as what needs to be provided for the mum, to help her get ready. Plumbing fixes, as I talked about, is the basin in the laundry, or is there an area where a bub can wash properly? So yeah, there's plenty of interventions all happening here. These guys are all trained in this. They have a Cert 2 in minor plumbing. They have a Cert 3 in pest spraying. So they're capable of doing this job. They're all trained. In some areas that may not be the case, but in the Pilbara, we do have all of our practitioners trained up to handle these positions and these outcomes.
And we're just going to talk about a little case study that we had, one of our earlier maternal EH referrals, and we're sharing with permission from mum and the agency. We had a new mum who was in a hostel but wasn't able to have bub in the hostel. So as part of the AFPP program and the My Home domain, obviously the team had realised that the mum doesn't have security in regards to housing. The team was able to use it as a, I guess, a platform to advocate to housing, looking at the priority and the factors involved, and were able to secure housing for the mum in this instance. And then the environmental health team came in and did a whole check with the mum, making sure that all the health hardware was functional, that it had pest spray, looking at options if that there was no need for rubbish removal, that they advocated for a washing machine. So they actually made sure that the mum had everything that she needs, so that when she births and comes to that home, she's set up to thrive. It also establishes a really nice service relationship with the client and the clinical team, and also the environmental health team, so that that mum can feel confident and safe to have Josh, who in that photo was the environmental health officer, to come back when Bub is 6 months age, for example, and just checking how she's doing and see if she needs any extra support. And we've got a little quote there which has come from mum on how she found the maternal referral support in that instance. And we will mitigate by saying this is a pilot program, so we are really learning and evolving as we go, and when we get more clients. And it is a really bespoke model. So whilst our offer of assessment and response is standardised across the region, the findings and then the referrals and the work that goes on as a result of that assessment are bespoke to the mum. So it can be quite different, a response for every single client that we've got there. Did you want to add anything else to that maternal case study, Scotty?
I can. I know Josh and Georgia did an amazing job, and there are still a few more of these at-risk mums and bubs within the system at the moment that we're working on having the same outcomes. But this is one of not the easier, but this is one of the better outcomes. Obviously, this is the ideal outcome. It's not always this easy, particularly with overcrowding, finding enough places for people to sleep and those sorts of things. So there's still many challenges. This is a great story. I definitely one of my favourites, but there's many challenges to these referrals as well. And I think we have a standardised practice where it's all safe, that allows us to have more outcomes like this.
It's also giving us a platform for advocacy to evidence a regional need in terms of, for example, housing. It's also giving us a need for water and water quality issues. So a lot of things, I guess, are resulting as a result of these maternal referrals that wouldn't necessarily have occurred before. So just bringing it back, because we have targeted today's webinar to clinicians, and really why are you central to this process? And that is, clinical observations are the first sign of an environmental health issue. So you are really at the forefront for seeing your clients and what are they presenting with. And by asking a few simple questions as part of your treatment program or offering, it can reveal some preventable conditions that might be occurring at the home. And as I say, they might be occurring. It's not assumed. It's just something to consider as a factor in your treatment. And early referrals can reduce repeat presentations and long-term health burden. So in the Pilbara, we're obviously offering the maternal referrals to all our pregnant women in the AMS services, but also the clinical environmental health referrals when an illness or disease related to the health of the home environment has been diagnosed. And just reminding clinicians that even where there's no environmental health team in your remit or your region, you can still have the conversations and link families in with the services in your area. And really following on from that, other things you can do if you don't have EH services in your remit is talking about home safety, hygiene, crowding animals, I don't know, Scott, if you wanted to give a little bit of a tidbit on why we talk about animals, and it's not necessarily for the animals' health, it's more for the human health.
I did mention that in one of the earlier slides, but yeah, anything we do is for people's health, and they involve different objects. So obviously, like the ability to wash, for instance, is quite important regarding health. Obviously, animals regarding the worms, mange and stuff like that. The mange mite can get on skin. It can bite humans, and humans obviously scratch and cause sores, so that sort of thing. So the animals are treated for those reasons.
Thanks, Scott. I must have gone down a little bit. And obviously, if you're seeing a trend of illnesses or disease presenting through your clinic, for example, skin health, if you're seeing a lot of skin-related things presenting through your clinic, you can organise, obviously, like community healthy skin days. So we've been running quite a lot of in the Pilbara, where we run them in collaboration with local clinics, the local schools, local playgroups and child maternal health centres, anyone who's kind of part of that community circle. And kind of, there's a photo there of offering lice treatments at the schools, healthy skin checks and treatment all at the same time. The Pilbara, we've been doing the healthy skin clinics at the same time as the environmental health officers or practitioners, have been going home to home, so that the messaging, the health promotion that we're giving at the school, at the community events, can actually be applied when everyone gets home. And we're handing out hygiene packs, so everyone has the tools and resources and ability to implement if they do so wish. Do you want to add something, Scott?
Yeah, and just adding to that, if it is a community-wide program, obviously any of those at-risk homes that may be, looking at shame and those sorts of factors, because it's a community-wide program, it's all diluted through, so every house gets the same service. It's a little bit different to the maternal service that we've been talking about, but the education and all the tools and the resources around towels and soap, toothbrushes and toothpaste and those sorts of things are provided. So, the education's given, the kids learn about it at school, but then they also have the resources to be able to practice those, sorry, I've lost the word there.
Put the messages into practice.
Yeah, put the messages into practice back in the home environment. So to be able to use that.
And we also see that as capacity building local workforce and agencies. So it's a model that can be replicated. Local health clinics are empowered they have the existing relationship with community. So we come as a support to the existing service providers with things such as the healthy skin clinics, to ensure that they occur when community wants, when community needs. And that it's done in a way that is culturally sensitive and appropriate. And just key takeaways from today: that environmental health is primordial and primary prevention. So we're trying to eliminate the risks or reduce the risks of that environment. The Pilbara's maternal environmental health pilot model demonstrates how collaboration can support maternal and child health outcomes, and every clinician can play a part, whether or not there's an Aboriginal environmental health service nearby. We really thank everyone for their time in listening to us talk. I'm sure you're sick of our voices. We'd love to hear thoughts, feedback, questions, if anyone has any, following our presentation. I see a question raised, please. Is Esperance?
Thank you. Thanks for that presentation. Do you know if there's a similar service in Derby? I can't remember if you mentioned that at the beginning.
Shire of Derby, West Kimberley have an Aboriginal environmental health program. I used to work at the Shire and I developed the environmental health program with them, so they know it very well.
So in terms of referral, can anyone make a referral, or how does that work? Like if we went to a home and we were worried about something in particular, like they had multiple puppies or lots of strewn rubbish and stuff like that? What would be the process?
That's a really good point about the request for service versus a clinical referral. I might go back to that slide. Sorry, while you're talking, Scott.
Yep. So it's generally a clinician that should be using the environment health referral form. What you're sort of talking about there is a request for service. So there's no actually, there may be illness within the home, but unless there's a diagnosed disease where that patient has visited the clinic and then that referral is sent to, say, the Shire of Derby, West Kimberley, then they would go and action that. You wouldn't need to say, oh, there's lots of dogs or there's cockroaches or pests within inside the home or it's overcrowded. They would pick that up on the investigation. So that's how the referral system works. If you had an inquiry, you could call that that team from the Shire of Derby and say, look, this house has lots of puppies, etc. Are you happy to come around with me being there? And we can see what the story is. The Shire does have a really good dog health program in place. So yeah, that may be the option. But yeah, if there was a disease present, a clinician would need to send that referral for them to be able to investigate that properly. If it's just a request for service for, say, overcrowding dogs and pests, then you could literally just call them and say, could you come and have a look at this house?
So the clinician, does that have to be a doctor or?
Nurse, doctor, Aboriginal health practitioner, anyone who's making the diagnosis or I guess supporting the treatment of a diagnosis.
Okay.
And I guess it's the real takeaway, and it was the thing that I really struggled with in the beginning when I was in the RHD space, is I was the same. I was trying to refer for cockroaches or mice, but I guess it's getting the diagnosis. You're referring for the diagnosis, and that's the diseases listed there on the referral form. The team who go to the home will then make a full home assessment, and they will evidence all those things as a need, and then they can either fix or refer on as required. And then part of the response, and maybe like speak to the response that the clinician can expect, Scott, once they've submitted a referral.
Yeah, so talking on that, the team would go out to the home. They have an app now that they record everything through. We don't have the slide on here, but it takes photos of all issues within the home. They can try and improve those conditions regarding the plumbing. They can do the pest spraying, those sorts of things. So they would conduct that full investigation, put that in a PDF form with date and time, who conducted it, and then send that back to the referring clinician.
And it has to be done with the client's consent before we make the referral, yeah?
Yeah, so it's ideal that the this referral form that we're showing on the screen now is signed by the we can say the tenant or the client, but it's also good to have the homeowner's permission as well, which can be a little bit tricky sometimes. But the Shire's team does have a good rapport, particularly within your like Mowanjum and those reserves around Derby, and then obviously up the Gib and out to the valley. So they do have a good service there. So they should know the whole process.
Okay. Sorry, and just to the last point, is there a difference? Do you find a difference between communities that are dry and those that can drink?
No, unfortunately, and I'll apply this statewide, not quite statewide, but the regions, the outlying regions wide, the infrastructure is generally all the same, and the same issues you have, say, in the goldfields with their infrastructure, the housing infrastructure, you have in the Kimberley, you have in the Pilbara, you have in the Gascoyne. So some of it is around healthy living practices, I guess, but then an overcrowding of it, some is also around the poor infrastructure, and the quality of water has a lot to do with this as well.
Okay, thank you.
Happy, Esperance, if you want to contact Scott outside of this, if he can link you up with the team in the area.
Okay, that'll be great. Thank you.
Was it a question from Rob? End up or accident.
Rob, do you have a question if you're there?
Rob's question was in the Q&A box. You can probably find it there.
Oh,
Okay.
sorry.
There we go.
We're new to webinars. Oh, all these questions.
There we go.
Okay, so Scott, there's one from Nicole Wade. Can you see that one?
Yeah, so Nicole, your local services would be, there's Troy Hill at Bega Gumbaynggirri, and also the City of Kalgoorlie have 2 employees there that can help you out with that service and that referral. And they are all good, experienced practitioners, and go all the way up to Laverton, Leonora, and to some of your southern communities as well. I can't quite remember the name, but even out to Junjunjara. So they're quite a good team. So I would contact the City of Kalgoorlie and or Bega Gumbaynggirri and ask for Troy Hill, and then they can work out or help you out there.
We also did a presentation with Bega and Troy Hill about the maternal referral response. I think they were quite interested there too. That might be a space to chat with them about. I see Rob's question. Does your team contribute to or advocate for sustainable solutions to overcome chronic issues? Absolutely. Did you want to chat, Scotty?
Oh, you want me to be the question guy? Yeah, it's a good question. And in the Pilbara, we've received within the last year over 240 of environmental health referrals. We've de-identified them and put them into basically categories of disease. And as the Pilbara, as a region, we're looking at with skin being our major, I think it was 70% of our referrals are for skin in the Pilbara. So hence why Sam talked about that skin health program, and we're applying the healthy homes domains around that, so everyone's getting that holistic wraparound treatment. So yeah, absolutely. Through these referrals, they can be used at a wider region to say, okay, well, these are the key issues for our particular area. How do we group together as a region and treat this as a one, with those prevention measures in mind?
And if I add to that, Scott, so that where we actually look at all is through the Pilbara Aboriginal Health Environmental Health Subcommittee, of what Scott and I both sit on, and that's where we do look. We have all the key stakeholders from across the region all come together and discuss trending regional issues and concerns, and then we form collaborative responses, and that's where that skin health stuff came, because we know if we can get on top of skin health, the flow-on effect for your ARF, your RHD, your kidney health, there's a lot of flow-on effect if we can really address the skin health as part of that primary health response. So we hope that's answered your question, Rob. But we want to get as proactive as we can and move into the proactive space and less in the reactive space.
And then Sam, you've got Lucy Carter has a question as well. It says, hi Sam, amazing presentation. Thank you. Please, do we receive back a report of what has been done?
I think that you actually spoke to that, Scott, that PDF that the EH teams will send back to the clinicians. So what we found in the Pilbara is the referring clinician will send it off, and then that referring clinician will then get the report back. In some institutions where there's a large number of clinicians referring and perhaps a high turnover of staff, that can get quite tricky for the EH teams, because they could be reporting back and the clinician might have moved on, or there could be a change. So we've really found that having EH clinical champions at sites really helps. So there's one email address that the EH teams are referring back to. Sometimes we find they get a little bit lost if there's not a central person or email for these. So yes, you absolutely do get a report back once the team have made contact, and that maybe that they made contact and the client declined. We never impose the service on anyone, or that they made contact and they were able to offer a service, and then what the follow-up plans were and where they've referred or what they've managed to fix. So yes, absolutely, and you can upload that into the client's clinical record. So the client does present again with perhaps the same illness. That's an opportunity to discuss maybe what else might be happening in that space. Thank you so much. I don't know if anyone had any other questions or queries. Well, we really thank everyone so much for their time today. We know you're all really busy, so thank you for taking time out of your schedule to listen to us. Oops, Emma. Huge value in the advocate for improved funding and support preventative health hardware, housing. Are you able to track outcomes improvements to really drive the message? Yes. So yes, we are. We obviously as a region, we're tracking de-identified clinical referrals to not only note the regional trends of disease. We're also as part of that PAHA forum, we have housing, we have water court, we have all the key players there, so we can actually start showing a message that perhaps there's not just a housing issue in the region, but there's actually a health issue associated with housing. So we're actually doing a lot of advocacy in that space at the moment, to exactly that, to advocate and track outcomes. Obviously, the maternal referrals, they really are an unfunded pilot project, but what our hope is as they gain momentum, with the number of maternal referrals rising, we're actually hoping to track incidents of, for example, in the Pilbara, of decreased skin disease infection, decreased incidence of otitis media, trachoma, ARF. So it's probably not going to be as quick as we would like to evidence, but we are hoping to track over time an increase in the maternal, those preventative referrals. And in an ideal world, you would have preventative referrals refunded, you know, for a whole range of chronic conditions as well. But at the moment, we're just targeting the maternal space, and then track that reduction in community over time.
Yeah, and I'll just add from an environmental health point of view, we've just been able to have the ability to basically see if any improvements that we make in the homes and that environment, whether they're reducing. So we've been into all of the homes within the Pilbara, as far as the remote communities are concerned, and we can now look at those to make sure that the next time that we go back, whether those improvements are, things are being fixed, and those issues and items, particularly around the home health hardware and affecting the ability to wash, are reducing.
Yeah, that's a good point. And it's also looking at service delivery for the healthcare services. So through these healthy skin clinics, it's actually evidencing that perhaps is a large percentage of community that aren't presenting to the clinic, perhaps the skin, and looking at reasons for why, and then they can actually adapt and mould their delivery of their outreach services as a result. So there's lots of potential in this space, and to ensure that it's community and local service provider driven.
I'll just a couple more questions. Esperance, yep, I'll definitely send you an email with my details and the Shire Derby's details as well, so that's okay. And then we have another question from Kylie. Apologies, I joined late. Was this recorded by any chance? I'm interested to link in about the support for Onslow. Kylie, I'll be in the Ashburton region next week, so there might be an opportunity for us to catch up in person, but this was recorded, so you can definitely watch it again. I'll be with the Murrunkara Health Service, and yeah, obviously Bindi, and some of the housing in Onslow definitely needs that support as well.
I think it's the Murrunkara Environmental Health Service.
Environment Health Service, sorry. Brilliant.
We're more than happy for Rural Health West to share our emails, but we are both at PAHA. And if you have any questions or queries, please feel free to shout out. That might be all the questions for today. All right. Thank you, everyone, for your time. We really appreciate it. And we hope you have a great day.